The second thing you need to know to ensure your implants last a life involves how to floss properly. Now go do yourselves a favor, grab a pack of these. These are Caredent Easy Flossers from Coles, $2.60 is what they cost at the moment. They look like this, and this is a good brand because I find this floss doesn't tend to break like other brands, and it just makes flossing so much easier than using the string. The string, you get your fingers in your mouth and all dirty. Here it's just flossing with one hand. Now, the first thing to know about flossing is you're aiming, when you're flossing through each contact, so you click, okay, you're aiming to clean two teeth surfaces. You're aiming to clean this surface and this surface. And how to make sure you do that is when you click through, you apply a bit of pressure towards the tooth surface that you're trying to clean. So you're applying a bit of pressure, you're going down and up, down and up. And then equally on the other side here, you're going down and up, applying pressure this way to make sure you clean this tooth surface, okay? Now, really important is you're clicking through the contact, okay? And that's important to clean your teeth, to stop decay from happening between your teeth. So you click, click. But you want to do more than that. You're clicking through and you're cleaning actually down near the gum. And that's where the gunk builds up. And that's what's important to ensure your implant stays healthy. This is the implant, this is the abutment, and this is the crown. And you're actually coming down. You don't want to be scared of touching the abutment. You're actually going down and up quite deeply in your gum so that your gums are clean and your implant stays healthy. And that relates to the second point about flossing is when you're flossing, you want to keep it strictly to a down and up motion. You want to go down and up on each tooth surface, down and up, down and up. The last thing you want to be doing is going in and out, like you would be if you were putting a towel between your legs and trying to clean. Because what that does by going in and out, is it causes the floss here to fray, and that frayed floss can cause damage to the implant if it stays stuck around the implant. The next important thing to keep in mind when you're flossing is when you floss, if it bleeds or if it's sore, you want to floss more, not less. And the concept is this: you've got plaque and you've got gunk that builds up on these teeth surfaces, okay? When you clean, and that plaque causes the gums to be inflamed. When touched by floss, that'll bleed. Now, when you clean the gunk off these teeth surfaces, give it a couple of days to a week, and the gums will resolve and it should stop bleeding. Now, an interesting thing about implants is an unhealthy implant will bleed and will be sore, but a healthy implant will still be a little bit tender, but it shouldn't bleed. That differs from natural teeth. Natural teeth, a healthy natural tooth won't bleed and won't be sore when you floss around it. The other thing to keep in mind when you're flossing, and this is going into a lot of detail, is when you floss, okay, this is the crown and this is the abutment. Remember, don't hesitate to clean down into these areas. You may find that there's a bit of a catch, as there is on this implant crown. Now, sometimes that's calculus, and that means you have to clean that area more, not less. The other thing is I'd mention to your dentist, that there is a bit of a catch on that side of the implant so that they can try and clean the calculus off. Now, potentially if that catch stays or if that bump stays after they've cleaned it off, there may actually be an issue with the crown. There may be a catch there, as there is with this one, because the crown's not seated properly on the abutment. And if that's the case, it needs to be looked at a little bit more. Now, what I do is when I floss around my mouth, I look for the areas that might be bleeding and might be a little bit sore. And those are the areas I actually concentrate on and try and floss more in those areas, because I know that's where I need to clean more. The other little thing I do with my floss holders is I keep them by my computer so I can pull them out at a moment's notice and floss really easily. I floss around my teeth, give it a little bit of a suck. In some ways not so hygienic, but in other ways it's a really hygienic or a really effective way of making sure I keep my teeth really, really clean. So that's it, folks. Those are the things that you need to know to make sure you're cleaning around your implants properly with floss to make sure they last a lifetime. This is Dr. Jeremy Lung, and I'll see you in the next video.